everyone, and welcome to another episode of Teeth Matter. I'm your host, Ellie Halabian, DDS, and I am so excited to share with you the launch of Teeth Matter Hangouts. If you haven't heard about it already, it's an exclusive membership community. It's a monthly membership where we get together on a regular basis, have live chats so that you can get some help in taking your next step. So whether you're a dental resident or a new dentist who is struggling with their day-to-day dentistry, or maybe doesn't know what their next step is and has questions about what to do next, then building your network is exactly what you need. This gives you the opportunity to make new friends. It gives you 24/7 online support. It gives you professional perks when it comes to career development. So go check out our website, teethmatter.squarespace.com, for more info and to sign up today. And in this week's episode, we're talking to pediatric dentist, Dr. Nikhil Sharma. Dr. Nick has been in the industry for a very long time. He actually started dental school at the age of 19, and so he's seen it all. In this conversation, we talk about what it means to start dentistry at a very young age, what is anxiety, talked about therapy, what it means to be an administrator, how do you deal with legal implications, and so much more. Good evening, Dr. Nick. Finally, we're connected. I see you every day. I was just telling you that. I feel like I get your content every day. I feel like I already know you a little bit, but thank you for coming on board and spending your day with us.
And I think it's the same here. I feel like I see your content all the time, and I'm like, I can't wait to be on this podcast. So I'm excited.
I love it. I love it. It's funny, when we connected, I didn't realize, I mean, you were a complete stranger and only an Instagram friend, but I didn't realize how much overlap we had. Like, I'm from Montreal, you're from Montreal, I went to McGill, you went to McGill. I applied to Rochester, you went to Rochester. Yeah. I mean, there's some similarities there, but for the audience who doesn't know you as well, can you just share a little bit about where you did your training and where you are now?
So I went to dental school at McGill in Montreal. I didn't do an undergrad. I went straight into pre-dentistry 1 year and then 4 years of dental school at McGill. And then I did a 1 year GPR at a pediatric hospital in Montreal as well, and then decided, yeah, that's what I want to do for the rest of my life. So went to Rochester, New York at the Eastman Institute for Oral Health, did a 2 year pediatric certificate, went back to Montreal, started practicing, as well as took over as a residency director at the Children's Hospital, and thought that was life, thought that's what I was going to do, and then somehow looked for new opportunities as I wanted to change my career and its path, and ended up in Toronto.
Wow. So, yeah. That's a lot of training. That's a lot of studying.
A lot of study, yeah, for sure.
It's funny. You said that you did this pre-dent pathway, and I'm familiar with this pre-dent pathway. A lot of students aren't. They're trying to figure out how to get into dental school. For those who are Canadian-based, can you explain what that pathway is and how they can go about that?
Yeah, so I don't know if it's anywhere else in Canada, but it is in Quebec. And what you do is you do high school in Quebec, and then you have 2 years of what we call college. So we do grade 11 plus 2 years, and this you can specialize a little bit more into like health sciences, pure and applied sciences, finances, all that stuff. And after those 2 years, you can directly apply into dental school through a 5-year program. So instead of the usual 4-year, you do a pre-dentistry 1 year and then 4 years of dental school. It is super competitive. There's about, I think, 200 people that interview, 200 people that apply, 70 people that interview, 10 people that get in. And then pretty much after that, you join the group of students that are doing the 4-year dental school. So pretty much just blend right in. And I didn't do an undergrad. I got lucky enough to get in. And sometimes it's a good thing. Sometimes I think, the undergrad is definitely a good experience.
Yeah, that's funny you say that. I had a friend who did pre-dent and went straight into dental school. And I was the one who was wishy-washy and kind of went on a zigzag. Yeah. But for a lot of students, I think, at least from my experience, even now, I didn't go straight from undergrad into dental school. I still took time after that. I went to do my master's. I did some, had some work experience, and then I went back to school. Do you think that someone who is, in high school or in CEGEP and thinking of doing a pre-dent pathway is necessarily ready to take on a career like dentistry? And what recommendations do you have for someone who's thinking about it in terms of preparing themselves mentally and physically?
I think that's the exact point I was trying to make, was that I got into a dental school at 19 years old. Did I know I wanted to do that for the rest of my life? Did I think it was the best career ever? No, that's what I heard at home. You either become a doctor or a dentist. I come from an Indian background, so that's all they really know, and that's what I was gonna do. I chose whichever one I felt like had a better lifestyle.
Right.
But I didn't know enough. I didn't have enough experience of the world. I didn't know what was more important, work-life balance, mental health, finances. I just thought, okay, it's dentist, it's respectful, perfect, I'm gonna do it, right? However, I feel like as you grow and you experience life, you start learning what is more important to you, and that's where I think you can make a better decision, especially when you're doing something like I did 8 years of school. After 8 years of school, when I'm 26, 27, and I'm finishing all my education, I'm not going anywhere. I'm doing this as a career for the rest of my life, right? Now I can't reflect and be like, oh, did I make the right decision? Whereas when you have an undergrad, you have the time to reflect. Now, not everyone has that mindset still, even after an undergrad, but at least you have a better chance than someone who's 19 years old and trying to make the decision for the rest of their lives.
That's very true. Even though I did undergrad, I still came into dentistry knowing I wanted dentistry, and then went to school, finished school, did residency, all that stuff, and now I'm here and I'm like, now what? Like, this is it? Like, it just doesn't, it's a bit disappointing.
Yeah.
I'm a little surprised by the outcome of dentistry. Maybe it's just because it's my first, maybe a little over a year of working, but were there any kind of realizations you had with dentistry as a career that you didn't know prior to, school?
Oh my God, everything. I feel like everything is a realization. So when I finished dental school, I think you learn how to drill, fill, bill. Definitely, you learn how to do that. You're competent enough to do that. But that's only like a quarter or 30% of the career itself. You don't know anything about finances. You don't know anything about billing and productions and collections and associateship versus partnership. You think you're going to work 6 days a week. That's what I told myself. I'm like, I'm going to graduate, work 6 days a week, and be financially stable, and I'm happy for the rest of my life. But that 6 days became 5, 5 became 4, 4 became now 3, because, yeah, like you said, it wasn't what I expected. I chose dentistry over medicine based on lifestyle. I told myself that once I'm done at 5 p.m., I can go home and chill. It's not like that. It's not that the lifestyle is bad. It's just, it's not all out to be what I thought it would be. So definitely, I think lifestyle wise, I think, even just the pressures of being a dentist, I never thought it was a stressful career. I never thought it was like, sure, I thought it was dentistry or working on people's teeth, but I didn't think I was doing heart surgery or brain surgery. But the anxiety and the stress level are pretty comparable, I think, as at least from my perspective.
I hear you 100%. It's funny. I'm like I said, my first year of work, and I already feel like I need to cut back from the 5 days a week to 4 days a week, and I'm trying to optimize that to 3 days a week. And you mentioned that you've done that and you're doing that. So let's just wind back a little bit. You went from being a resident and then being a resident at Rochester, then coming back to Montreal and being a program director. Now that's two different roles. That's going from resident to admin. On some level. What did you do to prepare yourself for that role? Because you were probably not familiar with any of that to begin with.
Yeah, so luckily my program director role was part-time, so I was still getting my feet into private practice, and I didn't want to give that up. So if they would have told me to do it full-time, I would have probably declined. But then again, I also never planned to become a program director. I never planned to go into education and academics so early into my career. I thought maybe, you demo for an afternoon here and there. It's like your volunteer work. You go in, have fun, you socialize with the other demos, just like we saw throughout school. But I didn't think I would take such a big responsibility. And honestly, there isn't a way to prepare. Like, there is no way to prepare, because I had no idea that this was an option for me after graduation. So I literally went in. I was able to luckily get mentorship right off the bat as a program director, as well as in my private practice. So I had someone just guiding me in both fields, and I was juggling both fields. I was doing 2 to 3 days private practice one week, 2 to 3 days academics and hospital dentistry. So my role not only consisted teaching, but it also consisted OR, it consisted on call. I did inpatient consults. So I did pretty much full hospital dentist part-time, and then full private practice part-time. So nothing to prepare. It was just more learn as you go.
Right. And it's funny you brought up the OR dentistry and also the on-call. When I was preparing for dental school, I had no idea that dentists had a residency to begin with and that they took call. And then I ended up at a level 1 trauma center. So then that was a whole different ball game.
Same.
So, and that just added so much stress and lack of sleep. And it just was an unhealthy lifestyle for me. And a whole new layer of stress that I was really unequipped to deal with. And I'm saying this because this actually brought me to therapy, because I realized I was stressing out. I was losing out on my relationships because I was so focused on the work, the hospital, that environment, the patients, the beeper, all these things, all these consult notes. And I was losing out on myself. I wasn't developing myself. I wasn't growing within myself, but I was also pushing away relationships because I didn't have time for relationships. And so then I sought out therapy to kind of, one, vent, and two, learn how to create boundaries. I know that's something that you've also looked into. Can you just share with us, at what point in your career did you realize that therapy is something that you needed?
So I just wanted to comment something about the pager. I still had PTSD 3 years after. When I used to go to the mall and I would hear the cashier beep, 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 I would right away panic thinking it's my pager. So I know what you mean. It's definitely a different lifestyle. It's not something that we were mentally ready for either. No one told us about that aspect of dentistry, residency, and all that. I think for me, because you guys have social media wasn't that big when I was doing residency and I was graduating out of residency and working in private practice. And plus, not that many people voiced anxiety in the dental field. We didn't talk about that dentistry is difficult or dentistry is stressful or pediatrics is stressful. I felt it and I felt like, okay, I just got to keep it in because nobody else is talking about it. And it took me, I think, so once I did all my residencies and I started practicing, I think after 2 years of practice, I realized I had a period of 6 months where I went through some stressful patient interactions, parent interactions, family interactions that I kind of felt, it discouraged me, but also made me feel like I wasn't good enough. And I started overthinking everything from that point onwards in my dental career. That started then pouring into stress and anxiety, started making me feel like I couldn't go to sleep at night, or I would be out and about with my friends, but I would be thinking about the next day of work. I couldn't enjoy the friendships. I couldn't enjoy my family relationships. It was affecting my romantic relationships. And I just felt like I was always on edge because I was constantly thinking about the next day, or I was still thinking about what happened that day. Even if everything went well, I was still looking for little pieces that didn't go well. And that's where I started becoming a real overthinker, I feel. And it wasn't so much that I felt dentistry was stressing me out. I felt like I was doing something wrong and I was overthinking every little move. I got an email from the clinic. I thought definitely my patient's tooth broke or something like that. I got a phone call. I would think right away, oh, I did something wrong. I get a call from my accountant. I would be like, oh my God, I didn't pay my taxes. So it started affecting all aspects of my life. And I think I didn't talk to anyone about it. As a male, you don't have your boys to sit around and talk about, hey man, I feel this way because of work. We don't talk about that stuff. So, and I didn't want to add that stress onto my parents or my family either. So I kind of just toughed it out, and I would go to sleep at night. I would wake up sometimes nauseous just to even get to work. And I said, this isn't healthy. So first I started by just cutting down my days. I went from 5 to 4, 4 to 3, not quickly to go to 3, but I went down to 4. And then I would tell my mom this, and I don't blame my mom. She comes from a generation where it's all hustle and work. She's like, oh, if you're scared, if you're anxious, if you're nervous, just do more days. The more you go into your fear, the more you'll fight it off. And at first I did. I was like, okay, maybe I do gotta add 5 days back. But then I realized, no, I can't do this for the next 30 years, 40 years, or however long my career is. And I just had to figure a way out to get out of it. So cutting days was my first way of dealing with it. Obviously, fitness and hobbies was another way of distracting myself, but I still wasn't solving the problem of the overthinker. So probably about 3, 4 years into my career, I moved to Toronto and I said, you know what? now I have some free time. I gotta grow as a person. I gotta be better as an individual. I gotta address these issues that are not only affecting my career, but everything else around me. So pretty much 2 years ago, I got a therapist, and it's cognitive behavioral therapy. So literally, it was a little bit of venting, but it wasn't so much about venting. It was more about strategizing how I can get through my day without having those overthinking tendencies. And to be honest, everyone says, just be positive, be positive. It's not that easy. Positive thoughts, yes, can come, but when you get into that spiral of those negative thoughts, it's almost impossible to pull yourself out. But therapy taught me that. It taught me strategies that I was able to, kind of just automatically do those strategies and be able to automatically see myself coming out of those spirals. And now I'm super happy and super great.
That's amazing. I feel like a lot of people, like you said, keep it to themselves, and that's a really hard struggle, like internalizing all of it. It's not doing you any good, and unfortunately you feel hopeless and you feel like you don't have any resources, and you think like you're the one who has to handle it and no one else can hear your pain, and that you're a burden to everyone else. And unfortunately that's not the case. There is help out there that you can find sources of help. It's just you have to look for it and seek for it, and sometimes the first therapist isn't the right therapist. Like I had to go through a couple in order to find somebody who clicked with me, who understood me, who can help guide me. And that's what you need, a guide, like you said, someone to help you build strategies in order to deal with life events and anxiety, so that when they're not there, that you can push through. So I'm very happy for you. That sounds really amazing. And to get to this point where you feel confident and you're not overthinking, you're not worried all the time, that's a bit of a relief, I'm sure.
Yeah, and I think just like you said, talking, I feel like what I was saying before was that we don't get to talk to other dentists. I mean, now people are doing it more. So I try to promote that in all the new graduates or new dentists that join us. I'm like, it's okay. Like, this is normal. You want to cut down days? Let's talk about it. Let's figure out ways that you could have that work-life balance that we all dreamed of having in dentistry. But the days that we actually don't work, we're still thinking about work and stressing about work. So let's get rid of that.
Right. Well, it sounds like now you have these strategies and you've implemented these good strategies, because you've also went from the 5 days to the 4 days to the 3 days, and then taking on a clinical director role at one of these practices, correct?
Yep.
So as a clinical director, I'm sure there's a lot more responsibility that comes with it. You have to manage a bunch of associates and their work and their quality of work. Has there been any hiccups or legal issues that have come around from that have added to your stress?
Yeah, so I mean, I did something similar when I was doing the program director. I had residents. I think of them as my associates. I used to think of them as colleagues. These were all new graduates that needed the mentorship. So the only difference is that they're able to take your guidance and be like, oh yeah, no, I believe what you're saying. I trust what you're saying. I'm going to listen to you, because they're freshly new graduates. When it comes to associates, I realize that you can't just tell them, that they did something wrong or this could be better. And I started seeing the reactions, and that took me a while to get used to. Sometimes, even just helping them out with complaints and legal issues, like negative reviews, complaints, those are like coming in left, right, and center nowadays in dentistry, right? It's become literally a service, a business. You get reviews the minute they leave the building. So for me, it's like dealing with those with the associates. I think that's been the most challenging part, and that's been my skill that I'm trying to improve in how to communicate that. But other than that, it's the same idea as training. A lot of our new dentists come in, they are looking for mentors as well. So I just fill into that mentor role rather than a clinic director or partner or owner of the office.
And have you had to deal with any legal issues or legal hiccups?
Luckily, we kind of been able to manage them before they get to the legal part. But yeah, we have, like, I've communicated with legal teams here in Ontario. We have, the dental legal advisory. So we've dealt with them, but it's never gotten to the point where it's turned into a complete legal issue. But has it, turned into a complaint, went to the college? Yeah, for sure, all the time. These happen, like, unfortunately, they happen more than we would like to. And a lot of them have to do with the finances, right? So patients are just unhappy with the financials, even if you do nothing wrong.
Even if you were sorry?
You do nothing wrong. At the end of the day, they just want to get out of that cost, unfortunately.
Right. And so I mean, I highly, highly recommend good documentation of anything you do.
Yes.
That goes for every student, like in school and once you graduate school. I write essays when I'm writing my clinical notes. I write paragraphs.
Honestly, that's one thing that I learned very well in the States, but this is my advice to all the Canadians that are listening. Do it, because I learned that everything could turn into a lawsuit when I was in the States. But when I came to Canada, everyone's so relaxed and chill. Oh, we don't get complaints. We don't get legal issues. I said, don't worry, it's coming. That trend is going to come here too. So it's better to be ahead of it by just, like you said, writing essays. Take your time, write everything.
Right. Now that you have this role where you're part-time, you're doing 3 days a week, are you doing anything on the side? I know you have your Instagram page and your social media page. That's a hobby. That's an interest that you've taken on. Is this is this one of the many things that you're doing on the side?
Yeah, so I was always passionate about teaching, and I think that's the part that I missed when I left the academic role. And I thought, I want to teach, so I definitely want to take this whole social media and turn it into online education for whether patients or dentists or healthcare professionals as a whole. I did some webinars throughout the pandemic. We just did it as kind of like a marketing and promotion, but I realized that that's something I still am passionate about. I love it when dentists learn about pediatrics and they're all excited to try these tricks and tips in their offices, and that's something I definitely want to build on. I also want to continue to educate patients. I feel like that's the biggest passion I have. Is oral health is still the most important. Even if I don't love necessarily the physical dentistry to do every day, I can do 5 days of prevention, 7 days of prevention if I had to, and teach parents and patients just how to manage dental caries and oral health.
It's funny, I actually had a pediatric patient today who was super cute. The first time I saw her and we did her prophy, and then she was super cute today when she came in. She remembered me and she was all giddy. And then as soon as we came to do the sealants, it was like, oh my God. Oh no, she thought it was a needle, the etch was a needle, and it just turned into a whole disaster. Because you mentioned you have some pointers, would you mind sharing a pointer with someone like me who has a pediatric patient who obviously flips when they see something?
The etch is the most common thing, and I actually am going to make a post on this exactly because I think that's the most common misconception, where they see the etch and they think it's the needle right away. So I do tell show do with that. So tell show do is like the best technique you can do. I pretty much tell them that I'm about to put shampoo on their tooth. I show them the shampoo. Now, depending on the age, I might take the tip off and just show them the syringe and put it on their fingernail or something like that, or on my glove, and show them that, look, it didn't hurt. And then I take that same syringe, right before I put it into their mouth, I put the tip back on, and I put the edge. So they never actually see the tip. So some things you gotta like trick them, but then there's also things that you could show them and then do it exactly how you showed it to them, so you gain their trust. And then sometimes it's just about, unfortunately you have to lie and fool them, and if it's for their advantage, I think it's totally allowed.
Do you find that the parents are harder to manage or the child is harder to manage?
Everyone always asks me what's the most toughest thing about pediatric dentistry, and it's not patient management, it's parent management. I think expectations have changed. Parenting has changed like crazy over the last 10 years that I've gone through school and practice, and you have to kind of adapt to it. If you still use your old techniques where the parent's not involved, you kind of push them out of the way, it's not going to go well. You do have to be empathetic. You do have to understand that these are young parents. Pretty much some of them are my age, and they're trying to be well aware. They're trying to not have that bad image of not taking care of their kids. So you just have to put yourself in their shoes, and somehow if you're empathetic, it will work out. It's more just you have to set your boundaries, and I think that's the hardest part, is setting those boundaries, especially as new dentists come out. They don't know when to say no, whereas me, I'm a little more confident, and I'm like, listen, if you're not happy with my style, I'll gladly find you a list of references and we can find you a second opinion or a second dentist. Eventually they always come back, but it's okay to put your foot down and have your boundaries with parents.
Right, and I think that confidence or boundary comes with experience. I don't think you necessarily have it right out of school, because I still have that issue even today, for example, with not a pediatric patient, with an adult patient. She needs a crown. Yeah. It's a fact. Yeah. She knows it, but she won't do it because of, finances. Yeah. And so it's like, but I'm in pain, this aches, it's sharp, it's this, it's that. It's like, I can't do anything, and I feel guilty. And so I kind of find ways to do patchwork, because that's also the environment that I was in, sometimes in residency because of the patient population. And so sometimes doing heroics only causes you more harm. That's what I've learned.
I always tell my residents and I guess new dentists as well, as I'm like, don't do anything that's against your values, right? At the end of the day, there is patchwork. Like I do in pediatric dentistry, we do a lot of patchwork, you know? So for me, it's not that it's against my values. I do handpick, you know, which cases I'll do. But if it's something completely, you know, against my values, I do tell them, I'm like, according to my experience, this is not something that I can do and I feel good about. I wouldn't do it on my own child, so I would not do it on yours. And simple as that, when you put it in that perspective where you wouldn't do it to yourself or to your child, and then you say no, unfortunately, I'd rather lose a patient than get a lawsuit. So I just, I pick and choose, but I do understand where the parents are coming from or finances are coming from sometimes, and I do try to help out within limits.
Right. Before we wrap up this conversation, is there anything that we didn't touch on that you'd like to bring to the people's attention?
I mean, we talked a lot about like dentistry and its stresses, and it's it almost started off, I felt like I was being very negative, but I do want to say I love dentistry as a career. I do think it's great. There's a lot of different aspects within the career. I think we think you have to work on the chair on a patient, and that's all really dentistry is. I've literally done everything but research when it comes to dentistry, and there's more than one way of generating an income. You just have to find the balance of what things work for you. So for me, 3 days is my happy medium in the clinic, but then I don't just sit and do nothing on those other 4 days. I am figuring out ways of, being a clinic director and helping manage a clinic, I get an income for that. I do social media and affiliate marketing. I get an income for that. Eventually, I want to teach and do online education. I'm going to generate an income for that. So if you are looking for a career that's well balanced, dentistry has its options. You don't just stop at the office. You just have to figure out a way that works best for you, and you have to know what you like about dentistry and what you don't like, and then figure out a combination of what works best for you. But don't be afraid. Don't be afraid to ask for it. I asked to work for 3 days and I got the offer, and the owner came up with a 3+2 type of balance for me, where 2 days I ran the clinics and 3 days I worked, because he directly asked me, he said, what do you want that's going to take you to move from Montreal to Toronto? And I spat it out. I said, I only want to work 3 days a week in the clinic, and 2 days a week I want to do anything else that generates income. And we figured out a way. So don't be afraid to ask for what you want, but also don't be afraid to go for what you want. I think there's more than one option in dentistry, more than 2, more than 3. There's many options in dentistry.
I love that you said that, because when I first got into dentistry, I thought there was only one way: drill, fill, treatment plan, and that's the only way you can make money. And then you have to work nonstop to generate that production, right? It's constant, and that's exhausting, and you'll burn out if you do that, I think.
Yeah, and that's exactly what it was for me. I thought not only mentally and not only the pressure and anxiety, just physically, I couldn't see myself. I had neck pain, shoulder pain. I can't do this, especially on pediatrics when you're bent over. I can't do this for 5 days a week for the next 30 years. There's no way. I'd rather have a long-term career of shorter amount of days or less amount of days and last longer than work 5 days a week and last 5 years and hate dentistry, right? I love the field. I just found a way to make it work.
For someone who's looking to cut back days and find another source of income, most dentists, we've only focused on the sciences, and we only know how to generate money based on our academic career and our profession. How would you encourage someone to find another source of income?
So I think figuring out first, having a plan is the most important part. So don't just cut back and not be okay with the financial cut. So if you can be okay with the financial cut down, then great. I wasn't ready for that. I was like, I'm not going to give up a day and lose money. I want to cut back, but either stay the same or increase. And I'll probably say that over the last 6-7 years that I've been gradually cutting back, my income's only gone up. So it's never taken a big hit, at least not for more than a month. So first and foremost, I think finding those treatments that you enjoy but also have more value. high ticketed treatments, right? That's what you want to go for. Invest in yourself to learn those, be an expert at those, and then do more of those and gradually start cutting back the other things. So for me, it was, being comfortable and confident at doing sleep dentistry. I knew would generate me income. I just had to be the best of the best when I do sleep dentistry and be comfortable with all my procedures. And I started adding my days in that, and gradually that made up for, sometimes 2 days of regular clinic is equivalent to 1 day of, surgeries. So I started making myself comfortable and confident in those surgeries that I'm doing the best care. And this way I was able to give up 1 day of clinic.
You mentioned being an expert in that and finding that one niche procedure and becoming an expert. And becoming an expert typically means like doing more of it, but also learning more about it. So taking classes. A lot of students coming out of school are worried about the finances of taking CE courses. What's your take on that?
I mean, start with some free CE courses if you can. There's plenty of those out there. Find yourself a mentor. Sometimes just seeing a mentor. Like, I always am open to people coming and shadowing me, no problem whatsoever. Like, I'll help them in any way I can. And I think for me, that's what worked for me. I had a mentor, literally followed them around, figured out how I can add sleep dentistry to my career, and I became better and better at it. And sometimes seeing, but then also eventually you'll start building your confidence. You'll start doing 1 procedure a month maybe. Now you gain that extra income, you invest, you become even more of an expert, you do 2 procedures and gradually work your way up.
Love that. That's amazing. You've given us so many good tidbits tonight. I appreciate that. For the audience who wants to find you and connect with you and see what you're about, where can they find you? Can you share your Instagram handles or any other links that you might have?
Yeah, I'm on Instagram at Nick the Dentist, Nik the Dentist, and I'm also on TikTok with @Nick the Dentist. So either of those places works for me.
Beautiful. I'll share that in the show notes as well. Dr. Nick, thank you so much for being with us tonight. I appreciate it. You were fabulous, and I loved our discussion.
Thank you so much for having me.